Looks like, well, hopefully we'll know in a moment when we do roll call that we do in fact have a quorum, but I wanted to welcome everybody to our Treatment and Recovery Subcommittee meeting. Chair Lisa Lee could not be with us today, so I'm going to do my very best to try to get us through a lengthy agenda. So now that we've been officially called to order, I will turn it over to Kelly to do our roll call to establish quorum.
Thank you. So Kelly Marshall for the record, Chelsea Cheatham.
Present.
Dr. Dixon.
Here.
Lisa Lee. Steve Shell.
Here.
Jeffrey Iverson. Jeffrey is on, but he said he might have some connectivity issues. Jeffrey, are you able to unmute and say that you're present?
Yes, I'm present.
Great. Thank you so much.
Okay, thank you, Kelly. So it looks like we do have a quorum. Moving on to agenda item number 2 for public comment. This is discussion only. Do we have anyone on the line to make public comment, Kelly?
So if you would like to make public comment, you can raise your hand or you can unmute yourself. We have a number of guests here. Public comment is going to be limited to 3 minutes per person, and no action may be taken on a matter raised during a period devoted to comments by the general public until the matter itself has been specifically included on an agenda as an agenda item that says it is for action. So is there anyone that would like to make public comment? You can do so by either raising your hand or by unmuting yourself. Okay, Mr. Vice Chair, I do not see any hands raised and I do not see any persons unmuted who shouldn't be.
Thank you, Kelly. So we will move on to agenda item number 3 for possible action. This is a review and approval of our minutes from the December 6th, 2022 subcommittee meeting. Hopefully everyone has had a chance to peruse the minutes. And we can certainly entertain a motion to approve those minutes.
Hi, this is Jeff. I will motion to approve those minutes.
Thank you, Jeff. Do we have a second?
This is Dr. Dixon. I'll approve them.
Thank you, Dr. Dixon. Do we have any further discussion regarding the minutes from our December 6th meeting? All those in favor of approving our minutes, please say aye. Aye.
Aye.
Any opposed? Great, motion carries. Our minutes from the December 6th meeting have been approved. So now moving on to agenda item number 4, that is for discussion only. This will be a review of our 2023 subcommittee guidance. And Kelly, I'm assuming I probably need to read through each of these elements.
So if you can review the 2023 subcommittee guidance, then I can review the survey feedback. And then you can, then the members can provide any additional feedback. There's a slide for that.
Wonderful. Thank you, Kelly. So in 2023, the SURG subcommittee members were asked to do the following: submit recommendations to present on your own whenever possible, or if you have a tangible recommendation you do not feel that you can present or on your own, then suggest a subject matter expert who can provide a specific targeted presentation related to the recommendation. And thirdly, provide a 5-minute presentation on each recommendation with time for questions and discussion following the presentation. Please do not include recommendations that are in the 2022 SURG report. However, if there was a recommendation previously included in the annual report that was listed under the title needs further research, you can resubmit along with additional research for the subcommittee to consider. Rather than utilizing an iterative weighting process, in 2023, subcommittees will be encouraged to present, discuss, and refine recommendations in the spring and/or summer, and then weight recommendations for inclusion in the fall for the final report. And lastly, the prevention subcommittee will have a comprehensive view, including primary, secondary, and tertiary activities plus harm reduction. There will be a full SURG meeting dedicated to harm reduction in April. So now I will turn it back to Kelly.
Thank you, Kelly Marshall, for the record. So that's summarizing the changes that we made. I sent out a survey link to you a couple of times in February, and then we reissued it in March. It was specifically both around treatment and recovery, but then also around harm reduction. I can, with the guidance of the subcommittee, reissue that again if that would be helpful. But in the survey, we did get some responses specifically about what worked well related to the subcommittees. And so of the 5 responses for the first piece around subcommittees, what you indicated was that you felt like we were able to cover more ground and kind of move the process forward and move it along effectively using subcommittees. You liked the prioritization process, and I would note that the 2023 approach more closely mirrors what this subcommittee did in 2022. So you did not go back and re-weight items multiple times. You weighted items, weighted as in the word weight, not W-A-I-T. And then you adapted and made recommendations and changed the ranking and the priority of the recommendations as we got into the fall. So the approach designed for 2023 really closely mirrors what you did in 2022. So that prioritization process was identified as a positive, and also the amount of discussion that we had related to recommendations. So I would go so far as to say other subcommittees met through October. You had additional recommendations that came back from other subcommittees when the SURG meeting, SURG group met as a full body in October of 2022. And so you had an additional meeting in December where you were discussing recommendations, the justification, the rationale, and the research links that you wanted to provide. It was also noted that having coordination and staff support from SEI is helpful. So we're happy to play that role for you. And sharing documents to compile information was another thing that was noted by 2 of our members. When we get to what could be improved, folks really wanted kind of more presentations on recommendations that were being contested in the SURG. So in some cases, we had 2 recommendations that were similar but had a slight variation. In other cases, when recommendations got to the SURG, there might be recommendations that actually were contrary to each other. And so having presentations so that the full body, and this would start at the subcommittee and then move to the SURG as a whole, could really all be playing with the same level of information. So a level playing field would be helpful. Also, better definition of subcommittees or full SURG meetings dedicated to the crossover recommendations. So in some cases, we actually were grappling with recommendations both in the full SURG meetings, and then they would come back to subcommittees as well. So more clarity about what is that process. If the same recommendation is going back to 2 different subcommittees to grapple with, can one be identified as the lead, for example? More predictable scheduling of meetings, especially for subcommittees. So you will now find that the subcommittee meetings have been calendared and should be on your calendar. And that the length of meeting should be shortened to 90 minutes or less. So we're, because this is an open meeting, we don't have a defined end time, but we can structure meetings so that they are not chock full of agenda items that all require discussion and then action, which can then make them more streamlined. Addressing harm reduction in its own separate capacity or having a harm reduction specific subcommittee was raised. And what I would note is that there isn't capacity to support a separate harm reduction subcommittee. However, we have dedicated the April SURG meeting, which will be the first meeting of the SURG since the adoption of the plan, the action plan, in January, specifically dedicated to harm reduction. And we have a number of presenters lined up as well. Asking SURG members what they would like to learn from presentations. So rather than just inviting a presenter to present, if you can give more definition about specifically what are you interested in? Is it best practices? Is it a specific component of a program? Is it about a specific subpopulation? The example I would give for this subcommittee for treatment and recovery, you specifically wanted a presentation for families involved in child welfare. And so we went out and got a presenter who then presented on a program that you then incorporated into a recommendation. And that was the program that facilitated treatment for families who had substance involvement, where there was child welfare involvement to prevent the child from being removed from the home. So just continue to note that if there are specifics you would like from a presentation, to feel empowered to ask for those things. And then more presentations from providers instead of from the state. So that was feedback we received as well. And so we will use that lens as we're reaching out to providers, or yes, to providers and presenters, and then better adherence to public comment period time limits. So asking people to hold their public comment to the 3 minutes at the designated time at the beginning of the agenda and the end of the agenda, rather than engaging in dialogue throughout the meeting. Okay, so I'll turn it back to our Vice Chair, Shell, for discussion.
Thank you, Kelly. Do we have any additional feedback from any of our subcommittee members before we move into our recommendations for 2023?
Nope.
Okay, great. Hearing none, then we'll move on to agenda item number 5. This is for possible action. This is a review of AB 374, Section 10 requirements specific to the Treatment and Recovery Subcommittee and the recommendations in the 2022 annual report. So in this slide, I will read through the various cross-cutting elements that were assigned to all of the subcommittees. And then eventually in a few slides, we'll then look at the ones that were assigned specifically to our subcommittee. So in this slide, item number B is assess evidence-based strategies for preventing substance use and intervening to stop substance use, including without limitation, the use of heroin, other synthetic and non-synthetic opioids and stimulants. Such strategies must include, without limitation, strategies to, number 1, help persons at risk of a substance use disorder avoid developing a substance use disorder. Number 2, discover potentially problematic substance use in a person and intervene before the person develops a substance use disorder. Number 3, treat the medical consequences of a substance use disorder in a person and facilitate the treatment of the substance use disorder to minimize further harm. And number 4, reduce the harm caused by substance use, including without limitation by preventing overdoses. Then moving on to item number C, assess and evaluate existing pathways to treatment and recovery for persons with substance use disorders, including without limitation, such persons who are members of special populations. Moving on to item H, examine qualitative and quantitative data to understand the risk factors that contribute to substance use and the rates of substance use and substance use disorders, focusing on special populations. And then item Q, study, evaluate, and make recommendations to the Department of Health and Human Services concerning the use of money described in Section 10.5 of this Act to address substance use disorders with a focus on the following. Number one, the use of money described in subsections 1, 2, and 3 of section 10.5 of this act to supplement rather than supplant existing state or local spending. Number two, the use of the money described in section 10.5 of this act to support programs that use evidence-based interventions. Number three, the use of the money described in section 10.5 of this act to support programs for the prevention of substance use disorders in youth. Number four, the use of the money described in section 10.5 of this act to improve racial equity. And number five, reporting by state and local agencies to the public concerning the funding of programs to address substance misuse and substance use disorders. And then lastly, in this slide, we'll review 4 additional elements that were assigned to all of the subcommittees, starting with item C. Assess and evaluate existing pathways to treatment and recovery for persons with substance use disorders, including without limitation, such persons who are members of special populations. Item E, evaluate ways to improve and expand evidence-based or evidence-informed programs, procedures, and strategies to treat and support recovery from opioid use disorder and any co-occurring substance use disorder, including without limitation among members of special populations. Item F, examine support systems and programs for persons who are in recovery from opioid use disorder and any co-occurring substance use disorder. And item J, study the efficacy and expand the implementation of programs to reduce the harms associated with substance use and substance use disorders while referring persons with substance use disorders to evidence-based treatment. So what we'll do now in the following slides is we'll go through each of these elements that were specifically assigned to our subcommittee that I just read. So again, item C is assess and evaluate existing pathways to treatment and recovery for persons with substance use disorders, including without limitation, such persons who are members of special populations. The recommendation reads as follows: to facilitate opportunities for entry into treatment and/or recovery, ensure that Black, Latinx, Hispanic, Indigenous, and people of color communities are receiving overdose prevention, recognition, and reversal training, and overdose prevention supplies such as fentanyl test strips and naloxone to reduce fatal overdoses among Black, Latinx, Hispanic, Indigenous individuals, and people of color in Nevada. Kelly, can I ask you a question?
Certainly.
Should we certainly be discussing these as we go along? Would you rather me just get through these and then ask the group at the end?
So Kelly Marshall for the record. So this is really to reground or reorient both members of the public and the subcommittee members to what recommendations this body made that were included in the full report in 2022. So these are the 2022 recommendations. And so we're really just wanting to inform the public. This is what this group has already done, the work that has already been done and forwarded to the state. And then what you're looking at is how it connects to what is required in those items A through Q of the legislation. So this specifically was a response to item C. So that would be how I would orient members of the public and reorient the subcommittee members to what you're looking at.
Very well said, Kelly. Thank you for that. I think I was getting lost in a lot of the detail here. So continuing on with the elements that were assigned to our subcommittee, item C, item C, evaluate ways to improve and expand evidence-based or evidence-informed programs, procedures, and strategies to treat and support recovery from opioid use disorder and any co-occurring substance use disorder, including without limitation among members of special populations. And item F, examine support systems and programs for persons who are in recovery from opioid use disorder and any co-occurring substance use disorder. Our recommendation as it relates to both of these elements was expand access to medication-assisted treatment and recovery support for substance use disorder, limit barriers to individuals seeking treatment regardless of the ability to pay, and encourage the use of hub and spoke systems, as well as recovery support, including use and promotion of telehealth, considering the modifications that have been made under the emergency policies, and pursuing innovative programs such as establishing bridge match programs in emergency departments.
And Mr. Vice Chair, Kelly Marshall, for the record, just to be clear, I think probably the screen doesn't show it as well, but it was item E and F, not C and F.
Oh, I'm sorry.
That's okay.
Those are my glasses. Sorry, Kelly. So continuing on, sections 10E and F also apply to the recommendations below that I will read. To facilitate opportunities for entry into treatment and or recovery, ensure that Black, Latinx, Hispanic, Indigenous, and people of color communities are receiving overdose prevention, recognition, and reversal training, and overdose prevention supplies such as fentanyl test strips and naloxone to reduce fatal overdoses among Black, Latinx, Hispanic, Indigenous individuals, and people of color in Nevada. And secondly, significantly increase capacity, including access to treatment facilities and beds for intensive care coordination to facilitate transitions and to divert youth at risk of higher level of care and or system involvement. Implement a specialized child welfare service delivery model that improves outcomes for children and families affected by parental substance use and child maltreatment. And then the last element assigned to our subcommittee was item number J, study the efficacy and expand the implementations of programs to reduce the harms associated with substance use and substance use disorders while referring persons with substance use disorders to evidence-based treatment. And this is an element that we had previously not determined a recommendation. So we wanted to open it up to our subcommittee members today for discussion as to whether or not we want to propose and approve a recommendation today for this specific element. So if there's any discussion from my fellow subcommittee members.
This is Chelsea. Yeah, I think it would be a great idea if we could propose something. I know that we're having that meeting specifically for harm reduction in April. Would we be able to propose things that we already have proposed for that meeting?
That's a great question, Kelly. Is that something we can consider?
So Kelly Marshall, for the record, I would just note that the subcommittees are designed, right, to break items A through Q in the legislation down into manageable chunks. But really the work of this subcommittee is designed to move up to the SURG and has to be approved by the SURG as a whole. So if the SURG as a whole in April brings forward recommendations that address item J, then this subcommittee doesn't need to replicate that work. They can endorse that work. And, you know, as part of the SURG in April, you could speak on behalf of that, or you could request particular presentations. And we have a slate of presentations already being under development. Does that answer your question, Ms. Cheatham?
It does, yes.
So Kelly, if I'm understanding you correctly, we could decide to move forward without having a recommendation in place for this specific element. Okay.
Kelly Marshall, for the record. So yeah, I think the work of the SURG as a full body is what is most important, because that's what goes into the annual report. If this group after April felt like there was a recommendation that they wanted to bring forward following the April full SURG meeting, it's absolutely within the realm of the treatment and recovery subcommittee to then bring forward a recommendation that would be considered by the full SURG. So it may be that it's a wait for right now, that you wait until you see what comes out of April. And then this body could then determine if there were recommendations it wanted to bring forward.
That would be my recommendation based on what Chelsea brought forward to us, but certainly open to whatever our subcommittee members think.
Kelly Marshall, for the record, I would also note that the group is not precluded from only making one recommendation. And in fact, you would have seen that with the BIPOC recommendation. It showed up, it was treatment and recovery recommendation number 5. And if I go back there, you can see that it showed up as addressing an element under 10E and F. But also on a previous slide, it also addressed a recommendation related to item C. So you were able to address 2 different components of the legislation with one recommendation, but you're also not precluded from making additional recommendations around items C, E, F, and J.
So does that conclude our discussion about these elements unless anyone has anything to bring up? Okay, great. We will move on to item number 6 on our agenda, which is for possible action. This is a 2023 legislative session update. And in the following slide, we will review the SURG recommendations that are aligned with the current BDRs and bills. So I will read through these as well. Senate bills that overlap with the 2022 SURG annual report recommendations from the Treatment and Recovery Subcommittee are as follows. SB 4 revises provisions governing certain programs to pay for prescription drugs, pharmaceutical services, and other benefits. And under this specific SB 4, we had there was a SURG recommendation number 5 to expand outreach for overdose and deploy personnel to people released from institutional or other settings after overdose. And also SURG recommendation number 13 was to ensure that Black, Latinx, Hispanic, Indigenous, and people of color communities receive overdose services and supplies. Moving on to SB 117, which revises provisions relating to community health workers. The SURG recommendation number 6 was to expand Medicaid for preventive services and access to care. SURG recommendation number 15 was to enhance compensation of health and behavioral health care workers, sustain and expand investment in community health workers, peer recovery specialists, and certified prevention specialists. And SB 119 provides for the continuation of certain requirements governing insurance coverage of telehealth services, with the SURG recommendation number 11 to expand access to medication-assisted treatment, or MAT, and substance use disorder recovery support, including telehealth.
Can I interrupt and
Yes,
ask?
Dr. Dixon.
Well, I mean, I see what has been done is we've taken a bill and, put down how we feel about but are we doing anything? I mean, are we testifying on these bills, or what is there an action that's involved in this, bringing those two together? Say?
I'm not aware, Dr. Dixon. I would have to defer to Kelly Marshall. Kelly, do you have any comment?
So Kelly Marshall, for the record. So Dr. Dixon, I think we're early in the process. I would note that obviously we were not in legislative session last year, right, as you were doing your work. But now that we are, we're seeing some development of potential bills that could either support or negatively impact the recommendations that you made. The starting point for the SURG for this meeting was to just raise awareness and let the subcommittee know that that there are bills that could potentially relate to recommendations you made. We know that there are legislators. So for example, former Chair Assemblywoman Thomas is currently working in the legislature. She will join this subcommittee once the legislature goes to recess. But we're not in a position where we can do anything other than track. So we wanted to track legislation and then afford the SURG members the opportunity to take action as individuals as appropriate, or for the SURG to request to discuss this when the SURG meets in April. So those are, I don't believe we have a mandate or a pathway forward beyond that. And I would just ask, I know that Rosalie Bordelev is our beloved dad who is supporting us today. Rosalie, I don't know if you want to give any guidance related to this body and legislation.
Good morning, everyone. Rosalie, or afternoon, Rosalie Bordelev for the record. I mean, essentially, the SURG is the larger SURG, compiles an annual report, but is essentially making recommendations to HHS regarding what to do with funds. And so the legislation, I mean, it's important to know what's going on, but I don't believe the subcommittees or SURG as a whole can necessarily have much effect in taking positions regarding any particular legislation. It's important to know what passes and what the laws are, especially because that'll affect what recommendations you make. I'm not sure if that totally answers the question, but happy to flesh out if there's additional.
Well, I mean, it just seemed that as a body, we might have some impact if we were to be testifying for some of these bills. It's getting a little late. A lot of the bills that are here have already been heard their first time around, so there's not a lot that can be done now. But unless we see that a bill is going really badly in our estimation. But anyway, I was just curious what our if anyone were interested in testifying separately, surely we could do that.
Yeah, Rosalie Bordelev, for the record. Yeah, for the body to take a position, I'm not really sure that that's something that was delegated to subcommittees. The SURG as a whole to take a position, it would have to be that position approved at a meeting, because that's the only way the body as a whole can really make a decision. Our office has actually issued some guidance this year regarding public bodies and taking positions on legislation. And it's hard because you have to get a meeting together to take that position. Now, doesn't have to be specific to the legislation if the larger SURG wanted to do that kind of thing, but any of you may always testify on legislation on your own behalf. To the extent that you mention your relationship with the SURG or with a subcommittee, I would ask that you specify that you're not speaking on behalf of that body. The opinions you're giving are your own, but you are always able to do that. And so I guess to the extent any of you want to testify or give your input, you're all on these bodies because of what you do in your lives outside of this body, right? That's why you have this valuable insight and this valuable experience for this body. So there is no reason at any point that you can't testify basically in your own role on any legislation.
Colleen Marshall for the record. Ms. Bordelev, is it not also the case that for members of the public, it's helpful for them to know that the official report, the 2022 report of the SURG, has recommendations? So for the members of the public who are guests here today, they could certainly, if they were in a role of testifying, be able to connect those dots at a hearing. Is that correct?
Yes, they could as well. I mean, the SURG report we're talking public documents here. So the extent that members of the public want to be able to talk about it or anything like that, there's nothing preventing them from it.
Great. Thank you for that clarification, Ms. Bordelot. Anything further, Dr. Dixon?
Well, I think SB 119, I guess, is the one, and is good, except for I think it Vanessa might be able to. She's one of the public here. She's one of the lobbyists I work with. I think it's doing away with, or does not include, audio telehealth, which is something we in the mental health business are not happy about. But anyway, just something we need to read that bill. I need to read that bill again.
Very good point, Dr. Dixon. Thank you. So continuing our review of assembly bills that overlap with the 2022 SURG annual report, recommendations from the Treatment and Recovery Subcommittee, we'll move on to AB 115, which proposes to revise provisions relating to substance use disorders. This relates to SURG Treatment and Recovery Assigned Element J, which is to study the efficacy and expand the implementation of programs to reduce the harms associated with substance use and substance use disorders while referring persons with substance use disorders to evidence-based treatment. Moving on to AB 138, which provides Medicaid coverage for certain types of behavioral health integration services. SURG recommendation number 6 was to expand Medicaid for preventive services and access to care. And SURG recommendation number 14 was to increase capacity, including access to treatment facilities and beds for intensive care coordination to divert youth at risk of higher level of care and/or system involvement. And then lastly, AB 156 in the following slide proposes to revise provisions relating to substance use disorders. SURG recommendation number 5 was to expand outreach for overdose and deploy personnel to people released from institutional or other settings after overdose. SURG recommendation number 11 was to expand access to medication-assisted treatment and recovery support for substance use disorder, including bridge mapped programs. And SURG recommendation number 12 was to implement follow-up, referrals, and linkage of care for justice-involved individuals with opioid use disorder. So we have a spreadsheet that outlines a full list of bills that have also been identified as overlapping with the 2022 SURG recommendations. Do we have access to that spreadsheet, Kelly?
Kelly Marshall, for the record, I believe that was part of the meeting packet, and I can pull up and see if I can pull that up for you. Sorry.
I'm on the wrong page.
Oh, actually.
Just while you're looking for that, Kelly, I just wanted to remind members that we don't use the chat because of the open meeting law. And so maybe we have a way of blocking that.
So Laura, I was looking, that was part of why I was a little late. Kelly Marshall, for the record. I was looking for the way to disable the chat. I did not do it at the start of the meeting. So thank you for reminding everyone.
Sure.
Thank you. Sorry about that.
So this is the document that went out to everyone. And so you see the recommendations and the status. So Dr. Dixon specifically, SB4 received a due pass out of Health and Human Services on March 9th. SB 35, there's no action yet for that bill. SB 117 has been heard, but there's no action yet. SB 119, yes, 117 heard, no action. 119, no action yet for this bill. And you can see what it relates to in column D. And then SB 128, no action yet. SB 191, no action yet. SB 197, no action yet. This is for all recommendations from the SURG, not just limited to treatment and recovery. Moving on to the assembly bills, Assembly Bill 69 was heard and then amended and due pass as amended. And that was the Nevada Health Services Corp. To include the repayment of loans on behalf of providers of behavioral health care. AB 115, no action yet for that bill. And I believe that all of the SURG treatment and recovery members should have received a copy of this in your meeting packet. AB 132 was heard on March 1st. And that was creating a committee to review overdose fatalities within the department and requiring the director of the department to appoint 10 members to that committee. AB 137 was also heard, and sections of that bill expanded the applicability of those provisions that any report is confidential and may not be used for criminal prosecution to apply to all fetal alcohol spectrum disorders. AB 138 was heard on February 20th. And AB 156 was discussed as a BDR. So I am not able to say more about that, but I think Laura Hale can. And Laura, Mr. Vice Chair, Laura Hale has her hand raised. As
Yes.
part of the SEI support team.
We'll turn it over to Ms. Hale.
Thank you, Vice Chair Shell. I just wanted to make people aware that the actions were effective last week when we had to get this in for posting. So there are more than likely updates since then. Some of these may have had actions taken, or the ones discussed as a BDR in particular, they probably have had a hearing by now, and we'll update those as we can.
Thank you, Ms. Hale.
You're welcome.
So Kelly Marshall, for the record, I would just note other items discussed as BDR AB 156 and 201. So that would go back to Ms. Hale's statement about that they may have been heard at this point, and then AB 277, no action yet. And again, as of last week. So I'm going to X out of that. And try and figure out why there we go. So I would turn it back to.
Oh, thank you. Yeah. Thank you, Kelly. So do any of my fellow subcommittee members have any other bills that you recommend that we add to the list for tracking purposes?
Yes, I do.
Yes, Dr. Dixon.
This is one that, I don't know, SB 242. This is a bill to approve, I don't know if you know, magic mushrooms, which yield the drug psilocybin. They're trying to get it approved to do research studies in this state, which they are being done elsewhere, which I don't have a lot of trouble with, but they also want to approve it for people that just have possession of over age 18 or over. And I guess many of us that work in the field of addiction are not happy with that idea that you get it into the over 18 population, and then no time it's in the under 18 population. So the people that have put the bill forward are of a group that seems to think that these plant-based drugs should become available and not having them available, having them in your possession should not eventually end up in some kind of legal mess. And, so they're anticipating these drugs should be available and not cause legal troubles. So anyway, the child psychiatrists that I work with are just very opposed to this this idea. So I'm just putting that bill up there as one we should watch too.
Thank you, Dr. Dixon. I was not aware of that one. I'm glad you brought it up. Any other bills for recommendation to be added to the tracking list? Kelly, I have a question. It's not a recommendation for the list, but I had a question. Maybe I've missed this along the way, but was there any SURG recommendation specific to workforce or that went into more detail about workforce challenges? Because the reason I bring it up is I know we have several bills being considered this year that are focused on workforce, such as AB 69.
I thought, Kelly Marshall, for the record, I thought that we had a recommendation related to workforce and it was specifically around community health workers. So I'm just going to scroll back through the recommendations that we had. I think I scrolled too far, sorry. Okay.
Yeah, I think that's an important one, and it comes out of the Behavioral Health Policy Board that I think Mr. Shell is on.
Yes, Dr. Dixon, thank you.
AB 37, is that it?
AB 69.
AB 69?
Yes.
So Vice Chair Shell, I see that Laura Hill's hand is raised. I'm thinking that we're missing one of our recommendations, but perhaps Ms. Hale could clarify that.
Well, I was just going to say, if you're looking at the overlap with current bills, it just depends on when we look at things again. But I will specifically track any other workforce things. You know, there certainly was that recommendation about community health workers and other types of behavioral health workers. So, and there are several bills out there, but I will specifically seek those out when we update this the next time around.
So, thank you. Kelly Marshall, for the record. Thank you, Laura. I would just note on this slide under SB 117, you see a reference on the second bullet point to SURG recommendation number 15 to enhance compensation of health and behavioral health care workers, sustain and expand investment in community health workers, peer recovery specialists, and certified prevention specialists. I thought that was part of a workforce recommendation.
Yeah, thank you for that, Kelly. I'd forgotten about that particular bill. Thank you. And then going back to Dr. Dixon's comment about AB 37, that's sponsored by the Rural Behavioral Health Policy Board, and that one is also focused on establishing a statewide workforce development center. So I think that's another bill that we should be watching as well.
So Kelly Marshall, for the record. So I added SB 242 and AB 37.
Yes.
Okay.
That's my understanding. Thank you, Kelly.
All right.
Any other comments or discussion from our subcommittee members? Okay, we certainly have a lot to be tracking throughout this legislative session, so thank you. Moving on to agenda item number 7, consider subject matter experts and topics for future meetings. I will note that 2 surveys were sent out to our members to submit recommendations. One survey provided the opportunity to submit recommendations and suggestions for speakers for the Treatment and Recovery Subcommittee. And the other survey provided the opportunity to submit recommendations and suggestions for speakers for the April 5th SURG meeting focused on harm reduction. It will also be noted that members of our Treatment and Recovery Subcommittee did not submit recommendations or speaker suggestions. But we wanted to open up today to see if any of our subcommittee members have any recommendations for speakers or for any topics for our future meetings. So we'll open it up for discussion.
And Kelly Marshall, for the record, if I may.
Yes, Kelly.
Michelle. I also wanted to note that there were speakers identified during the 2022 meeting cycle that literally we tried to schedule at 3 different subcommittee meetings and just never had, never were able to resolve time conflicts with the speakers. And so I just also wanted to note that we do have some speakers that this subcommittee requested that were in the queue, and that we would appreciate direction about whether we should just go back to that list and try to move forward and potentially bring them back to this subcommittee to then ask if there is anything specific they want to have that speaker present on, or if we should just follow up and continue to pursue those speakers that were identified during 2022.
I'm not sure how my fellow subcommittee members feel, but I would recommend that we reconsider those topics that we wanted to bring forward and see about getting them on the schedule for this year in future meetings. I'm not sure how Dr. Dixon or Ms. Cheatham feel, as well as Jeff.
I think Dr. Dixon has her hand raised.
Oh, yes, Dr. Dixon.
Well, and Chelsea really can probably answer this better than, you know, even though I know she doesn't work for Track B anymore. Do we have someone from Track B lined up to talk with us?
I think we have someone from Track B, Chelsea Cheatham for the record, that's going to be speaking at the April 5th harm reduction meeting. But I'm sure that they would be open to speaking during our meeting as well. Is there like a specific topic that you would want them to talk about?
Well, I think we did hear a presentation already from Track B. What my concern is that I have a feeling that Track B is underfunded and they don't have you know, the clinics I work in, we have vending machines, but I'm guessing there's not too many of them out there, and there could be more presence of them in more sites. And my guess is that they don't have the funding to really keep them all going. So so instead of understanding what Track B does, I think we need to figure out how to help Track B be more successful in getting their items, their vending machines out more into the community.
Chelsea Cheatham for the record, I completely support that idea, and I think it would be great to have someone from Track B also maybe talk about some of the other programs that they're doing throughout the state, because a lot of those programs are not funded and or underfunded. So I like that idea.
So, Mr. Vice Chair Kelly Marshall, for the record, just a matter of clarification. I just wanted to remind the subcommittee that we have been instructed to not make recommendations specifically around funding of specific programs. And presenters, when they present to the SURG and to the subcommittees, have also been instructed that they are to be presenting on evidence-based programs. So a recommendation can support an evidence-based program, but it wouldn't be appropriate, as I understand it, and I would welcome, you know, Rosalie or someone else to make a comment. It wouldn't be appropriate to actually make a recommendation to fund a particular program.
Rosalie, here, you're correct. Neither the subcommittees nor the larger SURG have power to choose any specific. And the direction that's been given from the larger SURG to subcommittees has been to describe particular characteristics of programs, to describe basically the goals that you're trying to get to with this funding. But ultimately, the decision of who to fund is made by others.
So, Mr. Vice Chair, one option would be that we could resend out a survey requesting recommendations, but because we have the subcommittee here, we wanted to give this agenda item its air and time for subcommittee members to bring forward recommendations for speakers as well.
Thank you, Kelly. How do our subcommittee members feel? Do we need some time to think about proposing other subject matter experts to bring forward, or do you feel comfortable with moving forward with the one recommended by Dr. Dixon and Ms. Cheatham?
Hi, this is Jeff. I would like the opportunity to respond to the survey. I apologize. I was out of the country for some time, but I'd like some time to think about it and make some recommendations.
Okay. Thank you, Mr. Iverson.
I just got a text from somebody who, one of the public comment who had to drop off, but another program that I don't think, I mean, that we're in, it's in the recommendations, but I'm not sure we've ever had anyone come really talk about the bridge program. And what it is and what it's attempting to do and what's getting in the way of it being successful. So yeah, the bridge program, and that probably would be Marissa Brown from the Hospital Association.
That's a great idea, Dr. Dixon. Thank you.
Yeah.
And Kelly, to Mr. Iverson's point, I also do think it would be helpful to resend the survey. I will admit that, you know, I'd like some more time as well to think about some others that I didn't necessarily propose in the previous survey. So if the group's amenable to that, I think it would be helpful to resend the survey.
So Kelly Marshall, for the record, thank you, Vice Chair Shell. If I can just recap what I believe I heard, a presentation from harm reduction on other programs, like from Track B on other programs throughout the state, so that are evidence-based. A presentation on the bridge program, reaching out to Marissa Brown from the Nevada Hospital Association, reissuing the survey to the treatment and recovery members. And in that email, I could list the slate of speakers that we had identified previously, that we were not able to secure as presenters in 2022. And what I don't want to do as your support is make an assumption you want all of those speakers. So maybe if you had that reference list in the email, you could determine if you wanted to resubmit a name for a presentation from that list. Would that work for the subcommittee and for you, Mr. Vice Chair?
Yes, I believe that does work. How do our other committee members feel?
Yeah.
Okay.
That works for me.
Yeah, for me.
Yeah, it sounds like we have the consensus, Kelly. So yes, that would be great.
Thank you.
Any other discussion regarding agenda item number 7? Okay, we'll move on to agenda item number 8, back to public comment for discussion only.
So again, Kelly Marshall, for the record, public comment can be provided through Zoom by either raising your hand or unmuting yourself. It's limited to 3 minutes per person, and no action may be taken upon a matter raised during a period devoted to comments by the general public until the matter itself has specifically been included on an agenda item for which action may be taken.
This is Vanessa Dunn. I realized that I linked the wrong bill in the chat. So anyways, I will follow up with you, Dr. Dixon, but I couldn't really fix that because I was told not to participate in the chat. So I won't do that moving forward. And sorry if I confused anyone. I had some other windows open. So sorry about that.
Thank you, Ms. Dunn.
I believe Dr. Mandel has his hand raised. I don't know if I'm promoting you, but I think it's Dr. Mandel.
It's Giuseppe Mandel, not quite a doctor, not yet.
Okay.
Long ways from a doctor, but appreciate the compliment. Giuseppe Mandel, there's no Hero and Heroines Foundation and Alternative Peer Group Las Vegas. Just want to thank you guys for everything you do, allowing me to drop in and listen to your meeting. It's been very informative, especially with the bill tracking. I do appreciate all the hard work and long meetings that you get into. I'll just throw our name out there since I'm not on the subcommittee with Tinhai and APG, is that we're always open to speak at any one of your committees or events. And we'd be happy to be in, help inform you and learn from you and try to fight for a common cause any way we can.
Thank you, Mr. Mandel.
Oh, and one more quick thing. I apologize.
Yes, Mr. Mandel.
Giuseppe Mandel, for the record. Also, I'm over of the Recovery Advocacy Project RAP. So Recovery Advocacy Day for us is on April 27th at 9 a.m. It'll all be through Zoom. So all these bills and stuff that we're tracking, it's a great event and it'll have a lot to do with a lot of that, as well as Tinhai's Aim for Recovery, April 29th is coming up. Great event. If you like shooting guns and golfing, it's a mix of both, and it all goes to a good cause. Thank you.
Thank you, Mr. Mandel. Do we have anyone else, Kelly?
I do not see any other hands raised. Kelly Marshall for the record, or anyone who is unmuted.
Thank you, Kelly. So before we move on to our last agenda item, I wanted to ask if our subcommittee members have any other items to bring up for discussion today. Okay, hearing none, we will entertain a motion to adjourn our meeting.
We
Anyone
have to have a
would like-
motion. I'll move to adjourn.
Thank you, Dr. Dixon. Do we have a second to adjourn?
This is Jeff Iverson for the record, and I will second.
Thank you, Mr. Iverson. All those in favor of adjourning our meeting, please say aye.
Aye.
Aye. Any opposed? We will adjourn our Treatment and Recovery Subcommittee and look forward to seeing everyone soon. Please take care. Thank you all. Kelly, have we stopped recording?